One person posted that they're on 4 milligrams of Suboxone, and it sounds like they're looking to transition to Naltrexone, and they're not sure if they need to wait a certain amount of time after stopping Suboxone before starting Naltrexone. Can you talk about that, Micah?
Absolutely. Before answering that question, we also need some background. So let's talk about naltrexone. Extended release naltrexone, which is also known as Vivitrol, is an FDA approved medication for opioid use disorder and alcohol use disorder. So it's administered as a monthly intramuscular gluteal injection, so right into the butt. That's right. This is very convenient for most people. Now, this will save you a lot of time and hassle of having to take a medication every day, but this also falls back to patient preference.
Naltrexone is an opioid receptor blocker. This is different from buprenorphine and methadone, which are opioid receptor activators. So once naltrexone's in your system, it pretty much blocks the effect of any other opioid that might be used on top of it.
So that's odd. How would an opioid receptor blocker help treat opioid addiction? I get that it would prevent someone from using opioids while on it, but wouldn't a person still have cravings and withdrawal symptoms while on it?
Good point. Well, the mechanism for reducing cravings, it's a bit more hazy. But when a person gets a cue or is triggered and has a craving, the reward circuit in the brain is actually flooded with endorphins, which are the naturally occurring opioids in the body that dull pain and increase motivation and bring on pleasure. So naltrexone blocks those natural opioids, which reduces cravings and the rewarding effect of the substance used. That's why it's used for not just opioid cravings, but alcohol. Sometimes it's used for methamphetamine and cocaine. It's even used for weight loss by possibly reducing food cravings.
Oh yeah, that is really fascinating. They're even using low dose naltrexone for inflammatory conditions, but I know that's a whole nother discussion. So, but when you block your endorphins and then it reduces cravings and reward, a side effect of naltrexone that I often hear is worsening mood or something called anhedonia, which is the inability to feel pleasure. Is that correct?
Yeah, this is also an unclear area because, first off, when someone gets onto naltrexone, they have stopped their opioid use and there is no more opioid receptor activation. So you're still in a state of acute withdrawal or this longer term version of it called pause or post acute withdrawal syndrome. So that begs the question, is it truly worsening mood because you started naltrexone, or is it due to the fact that the opioids were improving your mood before and now they're no longer in your system?
I get it. So that's a good point. So looks like the research is mixed. Now, there's a lot of studies out there, and they indicate that this is not as big as an issue as we think. But then the FDA label on naltrexone actually has a warning about worsening depression and suicidal thinking. So it's definitely something to be considered, but it's not definitive.
Very important question. Studies show that Vivitrol is just as effective as Suboxone or Methadone in preventing return to opioid use, aka relapse. One big paper that's frequently cited is this US based study in 2018, which reported Vivitrol is equally safe as Suboxone because they had similar rates of overdose. But the first major point about this study is that only 72% of people were able to start Vivitrol versus 94% of people starting Suboxone. And why is it so hard to start Vivitrol? You may have heard about this already, but with Vivitrol, you need to detox and be opioid free for 7 to 10 days before getting the injection.
That may not sound like much to someone who doesn't personally know the experience of opioid withdrawal or what we know as dope sick. But if you're watching this video, you probably know that it's very hard to suddenly stop opioids and then be in withdrawal for a couple of days, let alone 7 days.
Exactly. So even if Vivitrol is equally effective as Suboxone at staying off opioids, getting to that point is challenging. More than a quarter of people are not able to stay off opioids for a full week. Now, 7 to 10 days sounds like an arbitrary time period. Why do people have to get off opioids before starting Vivitrol?
Great question. This is because of precipitating withdrawal. Now, if you have opioids sitting on that receptor, the opiate receptor, and then you go and take naltrexone, naltrexone comes in and then it pushes off all the other opioid molecules and preferentially binds to the opioid receptor. But remember, naltrexone does not activate those receptors like other opioids or even Suboxone. So you basically have induced opioid withdrawal, which can be very uncomfortable and very risky. So that's a nice transition to the original question of the Reddit poster. Do I need to wait before going to Suboxone or naltrexone?
Since buprenorphine in Suboxone also activates the opioid receptor, you risk precipitating withdrawal when you take Vivitrol. I actually had a patient once share that he didn't tell his doctor he was on Suboxone and he actually got a Vivitrol injection. And guess what? He went into full blown precipitated withdrawal. So the official medical recommendation would be to wait 7 to 10 days off of buprenorphine before getting the Vivitrol shot. But there have been some recent studies suggesting that tapering off buprenorphine and stopping it for 5 days may have some success. This study had patients going down to 2 milligrams of bup on days 1 to 3, then stopping bup from days 4 to 7, and then getting Vivitrol on day 8.
So I'd also like to add that the study showed that people that were tapering were more likely to get onto Vivitrol if their buprenorphine dose was less than 8 milligrams.
Let's move on to the next big point, the other really big downside to Vivitrol. I personally don't think this is discussed enough. With Vivitrol, there is an increased overdose risk compared to Suboxone. In fact, in that 2018 study I talked about earlier, the risk of overdose was almost 4 times greater while on Vivitrol than on Suboxone. The crazy part is the original study didn't actually report this. They claimed they were equally safe. But in 2022, some researchers reviewed the data and reported this higher risk of overdose. And the reason why this happens is because when you're on naltrexone, you lose your tolerance to opioids rapidly. On Suboxone, your tolerance changes more gradually. So if someone relapses with lower tolerance, they're more likely to overdose. Let's summarize the main points. 1, naltrexone is an opioid receptor blocker. Its extended release formulation is an effective treatment for opioid addiction. 2, but it's hard to get onto because you need to be off opioids for at least 7 days, which includes Suboxone. And if you take it too early, you could precipitate withdrawal.
And 3, it also has a higher risk of overdose because you can lose tolerance on it. This means if you relapse and then if you miss an injection, it can be really risky or even fatal.